Okay, so we are ready to move into PTSD and trauma treatment. And some of the topics that we're going to cover in this brief teaching this week are goals for the treatment, the brain, and we'll give a real brief overview of some of the different brain components, and then roles of the therapist. So, in trauma treatment, what is the position of the therapist like? And then finally, we'll discuss some factors affecting the treatment. And in the next recording, we'll go more into the details of specific theories and interventions. So let's go ahead and get started, and you can follow along in the PowerPoint. The first slide is about perspective. And this quote by Vander Kolk sums up for me the perspective I wanted you all to take with you as you move into treatment. Working with trauma is as much about remembering how we survived as it is about what is broken. And this really emphasizes a positive model of wellness and wholeness as opposed to a medical model of viewing our clients through the lens of disorders. Our offices become sacred grounds for soul care, and the work that we're doing is important, and we are not doing it alone, and the Holy Spirit is involved with us. So that gives us a good perspective, not only of the importance of the work that we're doing, but also hope for recovery, especially when we're dealing with people that have suffered some of the most horrific things that people can suffer. So I think it's important that we as therapists maintain that perspective and hope so that we can help our clients to achieve hope as well. So let's talk about what some of the goals of our treatment are. I want you to just take a minute and think about, if I were to ask you, what do you think the goals for trauma treatment would be? Just think, what are some of the things that pop into your mind right away? You might want to write those down or just think about them as I move on to this section of goals. But I think that helps you conceptualize as a therapist, what are the things that you consider most important and what are you aiming for with the client? So here's a list of some of the ones that I came up with. First of all, we always want to focus on what does the client want to work on? So the client may be coming in with a significant trauma history, but either has already done some trauma work and is coming in for another topic, or just isn't ready to work on that yet, and maybe they want to work on their marriage. So it's really important to start where the client is, and remember to ask the client, what do they want to work on, and what are some of the goals that they have set for this specific therapy with you. Another goal would be focusing on increasing self-awareness. Some clients that have a lot of developmental trauma don't have a full appreciation and understanding of a fully developed self anyway. So it might be difficult for them to really conceptualize what self-awareness is. But this is something really in all therapy that we help clients move to deeper levels of understanding themselves. We want to also increase the window of tolerance for difficult emotions. For many clients, this is something that they've developed some avoidance skills to not have to deal with those emotions, and so they've been stuffed down in secret places for a long period of time. So as we bring those emotions closer to the surface, it's important to help the clients be able to tolerate that so that we don't do additional harm just by flooding them with these emotions or overwhelming their sense of coping. Another goal would be to work on relationships. I love this quote: "Our attachment bonds are our greatest protection against threat." I believe that we are created to be relational beings, both with the Lord and with each other. So it's very important that we have as a goal that we help the client develop healthy relationships, whatever that may be, whether that's with a partner or their family members or friends or a religious body, another connection in the community, but having relationships and improving the ones that they already have and helping them to establish boundaries and moving away from codependency and enmeshment and some other unhealthy interactions is another goal. So a general improvement in functioning, whether that be at work or at school, in self-care, whatever it is, improving functioning is very important. Integrating the trauma memories. So, as many people have stuffed some of the trauma memories or compartmentalized them, the clients will work on over time integrating this experience as part of their life story. And that's a big part of trauma treatment, that we can't go back and change the past. And so, what do we do with those memories? What do they mean? And as we discuss logotherapy in a later section, making meaning out of what happened, and sometimes looking at the good that came out of it, but not always. Sometimes there's just not a whole lot of good that clients can identify, and that's okay. But being able to integrate that these memories are part of their story, not necessarily defining their future. Reducing shame is a big component, especially of childhood trauma, and increasing self leadership and their ability to be authentically true to themselves and make decisions going forward that are based on what they want as a whole being as opposed to based on their trauma. A general decrease, obviously, in post traumatic symptoms such as hyperarousal, hypervigilance, intrusive thoughts, and that type of thing. As we decrease some of those symptoms, that can really only be done in the context of lessening the arousal, whether it's hyperarousal or even shutdown, as we'll talk about a little bit when we go into fight, flight, or freeze. So we want to move from some of the unhealthy coping skills such as dissociation and avoidance and fragmentation, and we want to move into coping skills that help them to better function in their present life. And improving self-regulation. Resiliency is a buzzword in trauma treatment that we can talk about this. So it's really the ability to bounce back from difficult situations, whether it's bouncing back from the trauma or even bouncing back from current day stressors, but helping them to regulate their emotions and not having a flat affect where they're not experiencing any emotions, but on the other end of the spectrum, not being flooded with negative ones. And then finally, being able to have mindfulness, the ability to stay fully present. So these are some of the overall goals for trauma treatment. I am going to move into the section on the brain, but I've posted several videos that will help. I don't think that lecture style is always the best way to understand the brain. So watching some videos where there's different illustrations, I feel for those of you that are visual can be really helpful. One of the things I just want to emphasize is understanding the central nervous system, the difference between a receptive state and a reactive state. So a reactive state is when the amygdala in the brain, which is the fire alarm system, if you will, when that is sounded, the body goes into danger mode. And fight, flight, freeze is a reaction that happens from the amygdala sounding the alarm. Now, when clients and all people are in this reactive state, the reaction of the body is focused purely on survival. So there's other things that the brain does that are temporarily taken offline. So for example, the frontal lobe that has more to do with communication, logic, reasoning, abstract thought is temporarily disconnected so that the rest of the being can focus on survival. So you can see that being in this reactive state then can cause a lot of complications for people. So for example, when people are asked to verbally recall what's going on, they may have difficulty speaking, they may have fragmentation in the memory or even minimal memory of something when they're in that reactive state. Having abstract thought and perspective can also be hindered. So when a client is triggered, it can be difficult for them to really logically think, okay, is this something that is a threat now, or is this more attached to the trauma that I've experienced before? So the goal is to be able to remain in a receptive state when there is not a current threat of danger. So in a receptive state, there's this window of tolerance where the client is able to keep their body relaxed and to keep their frontal lobe of their brain connected. So they can stay more present And then that way they can communicate and have logic thinking and all the other good things that go along with that receptive state. So I've given you the videos on the brain and trauma, and also one of Daniel Siegel, who is just an amazing researcher with when it comes to the brain, and he does a lot of work with children and parenting and flipping your lid, which you'll be able to see that video on YouTube as well. So the next slide talks about the two different states of hyperarousal and hypoarousal. So hyper is that fight-flight response where clients may feel anxiety, adrenaline. The addictions may come into play here as there's impulsivity, anger, heightened state. And then the opposite of that is the freeze response or the hypo response. This is where you see feigning death, dissociation, being disconnected, shutting down, that type of thing. So again, we want to help the client stay in the middle to where they're in a self-regulated state and the amygdala is not triggering either hyperarousal or hypoarousal if there is not a current threat. Now, obviously, if there is a current threat, then fight-flight can be very effective. But the point is that we want them to be able to determine, is there actually a current threat or is this a trigger from the past? So what is the role of the therapist then? I think the role of the therapist is very similar to other types of counseling treatment, to where our goal is to communicate empathy, compassion, being non-judgmental, being present, and active listening. I think that even more so, though, with trauma treatment, we want to assist the client in feeling safe. And what does that mean, and how do we achieve safety within the counseling session? That's something that we're going to discuss in our optional class discussions. Being able to provide feedback is important as well. So the counselor in the treatment model for trauma is definitely taking an active role. I think that there's some styles of treatment that are more passive, and while this is trauma treatment is reflective, it's still a very active role that we play. Helping clients to identify triggers and as opposed to actual threats is a very active position. Providing hope, so not in a way that we're guaranteeing full recovery or anything that may not happen, but always being very hopeful that regardless of what a client has gone through, that there is always the potential for healing and hope and full functioning. And if the clients are Christians and believe in integration of Scripture, using the Scripture with God, nothing is impossible, can be very helpful so that clients can be positioned to do the difficult work of treatment, knowing that it will produce good results. Remaining very consistent and reliable is important as well for clinicians, and this helps to establish safety and for you to be a safe person with them. So showing up on time, ending on time, getting back to them if they leave a message or something like that, just being very consistent and reliable. Modeling self-regulation, and this kind of goes with the next one, empowering the client and encouraging feedback. So if the client comes in and shares that they were very upset with you last session about something, being able to not be defensive and not escalate in our own emotions, but hear the client out and process with them is a good way to model self-regulation. And then finally, I wanted to wrap up this part of the role of therapist with a quote from Ogden that says, "The trauma therapist's job is to create in the therapy hour a neurologically regulating environment that enables the client's nervous system to experience greater safety and therefore an expanded capacity for tolerating both present and past experiences." And so as we help the client regulate in session, this will also help them to learn to regulate out of session. And when those memories and nightmares and flashbacks come, they will be able to practice a lot of the skills that they've learned with us. Okay, so let's move now into factors that affect treatment decisions. And you can see those listed out for you. Obviously, treatment goals. So, what they want to work on will determine how long you'll be working with them, what level of care they may need, and what theory you use. Comorbidity. So, what other conditions are at work here? Are they experiencing active addictions? Do they have other diagnoses that will play a part in therapy? Suicidality, obviously, any lethality needs to be addressed first and foremost. So that is something that will definitely affect the treatment planning. Chemical abuse, we talked about addiction, and concurrent medical conditions. So just as there may be comorbidity with other mental health issues, there also can be physical health issues that may need to be addressed. Looking at the level of care. So, do they require hospitalization and 24-hour care? Do they require maybe an intensive outpatient, a step down from inpatient? Or are they a candidate for individual therapy at an outpatient level? Looking at your own training as a therapist and competency. Now, this doesn't mean that you automatically refer, because there are times where you can gain competency just by doing your own studying and consultation. But also, there is a time and a place to refer. So, being able to evaluate your own competency level is important. We talked about treatment setting, treatment management, so having boundaries in terms of what you can and can't provide, how to manage a crisis, that type of thing. Treatment resistance, again, there may be a need for multiple modalities at work within your treatment plan. And then finally, looking at their motivation. What is their readiness for treatment? Preparing them with psychoeducation so that they understand what is involved in therapy, and sometimes helping them see that symptoms can increase first before they get better, especially as you move into trauma memory work. So really doing an excellent job in preparation is key when we're talking about trauma treatment. I know that we've gone over last week about assessment, but I wanted you to keep in mind as we're moving into trauma treatment that we don't look at symptoms solely as negative outcomes. There's a lot of current research now that's looking at symptoms as a part of the body's way of surviving during the trauma. So, in other words, as trauma memories. And I find this just fascinating. And I think that it's really a direction that we're moving in that's a positive direction. So it's looking at the client as a survivor and better understanding that these symptoms may have played an important role in that survival. So for example, looking at shame may have been a resource for a child that was being abused because it helped them feel smaller and maybe less noticed. Hypervigilance could often help someone prevent further danger if they were hypervigilant and always waiting, analyzing their environment and waiting to see if that would create further threat. And then other ones such as dissociation. Even though after the threat has ended, dissociation can definitely be maladaptive and cause problems with functioning. During a threat, it can be very adaptive. So for children being abused again, or for a military person that is being held against their will or something like that, the brain being able to check out in the midst of something horrific it is a survival mechanism. So it's important that we have good understanding of these trauma symptoms and what they've done in the past and what we need to do to work with them so that they are healthier for the client in the present and future. The therapeutic environment, again, we talked about that, really establishing empathy and safety, helping the client to ground to present safety, and we'll go over a lot of different exercises in how to be present in the room as opposed to the brain kind of pulling the client back into the trauma. Containment is another important word in trauma treatment. So if you think about a faucet where you turn it on just a little bit and let it drip, as opposed to turning on the faucet full blast, that's what we would call titrating. So helping the client to titrate their work, helping them to have awareness of their SUDS levels, where they are in that 0 to 10 scale, and being able to contain the really strong emotions. Which again ties right into affect regulation, being able to be in that window of tolerance for the emotions. Being able to make meaning out of their trauma is going to be an important part of therapy, because there are a lot of existential questions that come up for people that have suffered horrible things. And as a therapist, you don't have to have the answer to those questions, but being able to normalize the questions, validate the questions, and stay present as the client works through them. Talking again about relationships not only with other people, but also with God or whatever their spiritual beliefs are. Those relationships can greatly be impacted both positively and negatively by trauma. So it's important for treatment to explore those issues with the clients. And then finally, doing grief work, because a large part of trauma involves grief and loss. And this is something that we don't cure the client of, but we validate the experience, and we again help them to move through the grief as opposed to avoiding it. And even being able to grieve some with us, just being present for that and being a witness to the grief can be a very powerful experience for them. So we'll discuss further questions in our class time and collaborate. I mentioned a few of them before, but I look forward to processing all this information. So this is a lot to take in. Hopefully these smaller videos will give it to you in chunks. And then as we get together, write down any questions that you may have about trauma treatment, and we will definitely go over them together. So I look forward to seeing you all in our next class.